My name is Mahmoud Rabi. I'm a consultant ophthalmologist and I'm the clinical director for ophthalmology here at CHEC. Today we are in CHEC Watford. Makes sense for the minimally invasive glaucoma surgery. Glaucoma is a chronic disease, got two traditional ways to be treated with, either with eye drops or laser. The other option would be the invasive surgery. With the introduction of the MIGS services and MIGS surgeries in the glaucoma world, the patient is able to have these small incisions, minimally invasive, minimal tissue disruption, and faster recovery that will address his glaucoma needs, being less reliant on the eye drops, better control of the intraocular pressure, which is the main factor that leads to the progression of glaucoma. MIGS is suitable for mild to moderate glaucoma patients who is undergoing cataract surgery. So any patient with history of glaucoma undergoing cataract surgery, the clinical guidance say that they should be offered the option of having the minimally invasive glaucoma surgery, simply because, if the patient is going for surgery anyway, then it's more appropriate to address both conditions together. Yes, cataract surgery might control the intraocular pressure, but for further control of the intraocular pressure, we can add the MIGS service. So the cataract surgery itself takes anything between 5, 10, 15 minutes. MIGS is an extra step. So it's just an extra step that takes around 2, 3, 4 extra minutes during the surgery, whether it's at the beginning of the surgery or at the end of the surgery. There are two ways to do the MIGS surgery that we offer at CHEC. One is actually using a stent that is left in the anterior chamber angle, and that will maintain the drainage between the anterior chamber again till the collecting channels. The other option is what we call cannulation and viscocanalostomy of the anterior chamber collecting system. So you introduce a surgical system, which is basically injecting a heavy viscoelastic across the drainage system so you can unclog any blockage in this area. With this type of surgical system, you're not leaving any implants inside the eye. Intraoperatively, patients, they don't feel anything, because again, it's an extra step during the cataract surgery. The patient feedback is great, simply because of the chronicity of the glaucoma. Patients are under impression that they will stay on these eye drops forever. Traditional glaucoma surgery, the standard glaucoma surgery, involved actually, as we explained, is changing the whole plumbing system for the unclogged, for the clogged sink. So that's an invasive surgery, and it was preserved only for the advanced glaucoma patients where the intraocular pressure is not under control. But now, with these MIGS, patients with mild to moderate glaucoma who are just using the eye drops can get that MIGS, address their glaucoma. When we introduced the MIGS, we sort of trialed it first in a few hospitals. The reason for the trial was to put everything under control in terms of the governance around the service, the clinical effectiveness of the service itself, and what is the feedback. And to be honest, it was exceeding expectations. Patients were happy that they had that service in a community location rather than waiting for the long waiting time in the NHS hospitals to get this type of surgery. Also, one of the benefits that we had as well is when we get the loads out of the NHS operating theatres, they can do the more complicated glaucoma surgeries, the traditional glaucoma surgeries, for the advanced glaucoma patients. So I think it works both ways between us, between CHEC patients and the NHS hospitals as well. The independent sector did really well in relieving the cataract waiting time in the NHS. It's time now to work collaboratively with the NHS to see what they are struggling with, and then we can alleviate what we can do in the community. Because if you look at the ophthalmology world, the clinical world, there are much more that can be done in the community setups. For the patient, for the quality of service, for the feedback, it's nothing different to have the service between the NHS and our community sites. So there are more and more that can be done, whether it's in the glaucoma, in other specialities in ophthalmology. There's still more that can be done in the community. I wish at the end of this phase and going to the next phase that we apply the service in more and more hospitals, reaching to more and more locations. That means more glaucoma patients will benefit from this kind of treatment, and also relieving the pressure from the NHS hospitals. They can then focus on the more complicated glaucoma surgeries that we cannot do in the community.